Let's talk about some of my favorite misconceptions and stigmas about Accutane. One of the most common ones that you'll hear is a universal stance on very severe side effects. So think joint pain, think blurry vision, think all of that, which is very untrue. So for example, a lot of people just get very mild side effects such as, dry skin, dry lips, because they're considered rare side effects for a reason. A really common misconception is that you'll have lifelong, long-term side effects from taking Accutane even after you stop. That could include GI problems and digestive problems, and that could also include lifelong dry skin. Most common side effects that you get while on Accutane will stop happening once you get off of Accutane and stay off of Accutane for about a month. Another thing is fertility issues. Everybody knows that you're not supposed to get pregnant on Accutane, but just like before, once you stop taking Accutane, the side effects that you would get with Accutane no longer exist, and that also includes the fertility and the birth defects. And lastly, a lot of people like to consider Accutane as a last resort, implying that its side effects and process of doing Accutane is so unbearable that it should only be considered as a last resort. For some people, that's not the case. Like, for example, I chose to do Accutane. I could have done other prescription items, but chose not to because I knew the efficacy of Accutane would be really, really great as a long-term solution for my acne. And ever since then, my skin's been good. All that to say, stigmas are stigmas for a reason. If you are even considering Accutane, it's always worthwhile to just talk to a doctor or contact Clear Health to talk to our doctors and see if you would be a good contender for Accutane.